US economy has experienced a surge, while Canada continues its 6-year-long pattern of stagnant economic growth.
Police union leaders gave a scathing testimony during a Justice Committee against liberal bail laws, the federal gun confiscation program, and so-called safe supply policies.
A new report found that more Canadians are on medical wait lists than they were at the end of the COVID lockdowns in 2022. Hello Canada, it's Monday, September 29th, and this is the True North Daily Brief. I'm Isaac Lamoureux.
And I'm Walid Tamtam.
We've got you covered with all the news you need to know. Let's discuss the top stories of the day and the True North exclusives you won't hear anywhere else. While the US economy has enjoyed a recent surge, Canada's economic growth has been stagnant for the past 6 years. University of Waterloo economist Michael Scudard noted Thursday that Canada's real GDP per capita fell at an annualized rate of 0.97% between the first and second quarters of 2025, according to updated population estimates. Real GDP per person was higher in the second quarter of 2019 than in 2025, showing, quote, no economic growth in 6 years. By contrast, the U.S. economy expanded at a 3.8% annual pace from April through June, a sharp upgrade from the government's earlier 3.3% estimate, according to the Associated Press. Consumer spending rose 2.5%, up from 0.6% in the first quarter and well above the 1.6% previously estimated. The spring rebound followed a 0.6% first quarter drop in U.S. gross domestic product, caused largely by a surge in imports ahead of President Donald Trump's latest tariffs. Imports then fell 29.3%, boosting second quarter growth by more than 5 percentage points. A key measure of underlying U.S. economic strength, which includes consumer spending and private investment, grew at a 2.9% annual pace, up from 1.9% in the first quarter. The contrast leaves Canada's economy looking stagnant. With real output per person still below its pre-pandemic peak, Canada has seen no per capita gains since mid-2019. So, Walid, what are some ways economists and business leaders have proposed to make Canada more economically competitive?
Well, look, there's been a whole range of things, Isaac. Frankly, Canada's economy is not looking good from any indication, whether it's our present situation on trade or the future with our debt and deficits. Many experts that once I've been listening to throughout my coverage on the economy have suggested that, first of all, Canada does need to look into potentially striking that trade deal with the US that Carney has promised since the election. That trade deal itself would make a much larger difference than any deal with an Asian country like Indonesia or any fringe European country out west, simply because the United States makes up such a large part of our trade and shared industries across the border that it would have a significant impact. We'll talk about this later in the show. We also have a very precarious fiscal situation with governments across the country running deficits, and our overall debt looks to pass 2 trillion, which is beyond our GDP already. So frankly, Ottawa has to clean up on its spending, capping spending, bringing a budget of austerity this fall, and multiple budgets of austerity, of course, with much greater spending cuts than that proposed 15% on the bureaucracy, which has, by the way, grown by 99,000 workers in Ottawa alone over the last decade. And of course, with that, also wages for that public service have gone up, not only in the House of Commons, but also among managers. I think there's around about 9,000 government managers, bureaucrats that receive over $150,000 in annual salary. So obviously spending is quite high. The military spending project as well is not going to help that situation any further. The drop of tariffs, the elbows down approach, so-called, by Mark Carney on the US, which technically speaking generates less government revenue, that will continue to increase the deficit larger than that of Trudeau. And of course, we've been hearing from the PBO budget officer, the interim budget officer, who I don't expect they'll be staying around much longer if the Liberals are in charge, talking about just how our future outlook looks very gray at the moment. So definitely spending cap, cuts, and austerity are the most significant measures to drive, let's just say, a better economic growth outlook, where you can look at potentially cutting taxes, red tape, taking off certain industry taxes and whatnot, cutting, of course, other carbon tax related policies and other environmental regulations would definitely have a tremendous positive effect.
Yeah, Walid, I'll just mention quickly, because we, of course, saw the parliamentary budget officer testify in the House of Commons last week, and it was damning, to say the least. Of course, we haven't received a budget from this Liberal government yet, which is saying something considering we got budgets through World War II, the Great Depression, and so on. So the fact that we have don't have one, sorry, is inexcusable. And the parliamentary budget officer, the interim one, that is, he said the numbers he's seeing are, he said, quote, shocking and stupefying. I mean, he was calling, I think, for economic collapse almost within a year and a half if the Liberals don't get their spending under control. So it's not looking good at all.
Police union leaders blasted the Liberal government on Thursday, pressing them on lax bail oversight, repeat offenders, and safe supply policies, and the federal gun confiscation program. Several police unions heads appeared before the Standing Committee on Justice and Human Rights on Thursday to express their concerns. The committee had not met since the early summer, when it adjourned for several months despite rising crime in Ontario and a last-minute pledge from the Carney Liberals to enact substantive criminal justice reforms ahead of the most recent federal election. After a lengthy delay, Canadian Police Association President Tom Stamatakis, National Police Federation President Brian Sauvé, and the Toronto Police Association President Clayton Campbell appeared before the Standing Committee on Justice and Human Rights on Thursday. They raised concerns about officer safety, gaps in federal bail data, recruitment and retention challenges, safe supply programs, and the need for stronger federal support for frontline policing. The Liberal government firearms confiscation program, first billed as a buyback program in 2020, was also a major focus at the committee. The initiative, which banned more than 2,500 previously legal models, has faced repeated delays, confusion, and controversy. It is now slated to conclude by the end of 2026 at an estimated cost of nearly $2 billion. Conservative MP Andrew Lawton cross-examined the witnesses, questioning the efficacy of the program.
My Liberal colleague actually raises an important point here, which is that law-abiding gun owners have nothing to do with crime. So I'll ask you, Mr. Campbell, because you have spoken about that in the past. Do you believe that law-abiding firearms owners in Toronto are a public safety risk?
No, and we've talked about this before. The gun buyback program is going to have zero impact on the crime we're seeing in the city of Toronto, period. And quite frankly, I don't know if there's any plan in place, but if there was some sort of plan to try and obtain these firearms, I'm not sure who's going to do it or what resources. And I can think of 100 different ways, if you want to help public safety in the city of Toronto, that we could have other things to do.
So Isaac, I heard you spoke to Public Safety Minister before, but what I'm hearing seems to poke some serious holes into the Liberal government's gun confiscation program. What other ways in the last few weeks has the program been put into question?
Yeah, Walid. So the numbers of which this program has been questioned and criticized seems endless, but I'll break it into four concrete things that have happened over the last week or so. So first, frontline assessment, which you mentioned briefly, because at the Justice Committee on Thursday, Clayton Campbell, as you said, the Toronto Police Association president, he testified that the federal confiscation scheme will have zero impact on the violence his officers are seeing, so it will do nothing. He also said, of course, that as all police associations have been repeating over and over and over again over the last several years, that almost all of the firearms used in crimes are illegal and come from across the border, and in fact that many of the offenders are already prohibited from even possessing guns because, surprise, surprise, they're out on bail. And that testimony came alongside broader union concerns about, as you mentioned, bail data gaps, repeat violent offenders, and safe supply policy impacts on public safety. The second thing I'll cover is enforcement capacity, because one of the many things in the leaked audio that Public Safety Minister Gira Anandasangri told his tenant was that he doubted municipal police have the resources to do this. And of course, that was the same recording where he said he would bail out his tenant if he was arrested, although he did also say that he would be unable to pardon his tenant's criminal record when he would be prosecuted. But in a subsequent statement, the next day actually, Ananda Sangri tried to claim this was a bad attempt at humor while he was launching the Cape Breton pilot of the program, but perhaps he just thought nobody was listening and he accidentally told the truth. The third point is, of course, participation by police forces and provinces. Ananda Sangri himself has confirmed that the Ontario Provincial Police will not participate in this. Alberta, of course, has repeatedly said they will not participate in this, and they'll even block municipal police forces from doing so. And then, of course, we know the pilot project for this gun confiscation program is happening in Nova Scotia and Cape Breton, but Nova Scotia Police has also said they will not participate in this, and that the Cape Breton pilot is actually just some sort of agreement between the federal government and the city. So the province is saying, we're not doing this, and the city is moving forward with it. And then the fourth, again, which you mentioned, is cost, timing, and scope, because we know this initiative was introduced in 2020 and now bans more than 2,500 firearms, but has repeatedly been delayed, and the amnesty has repeatedly been extended. I know you mentioned it's now slated to end at the end of 2026, but that might just get extended again. And Nanda Sangri has said that the budget cap is $742 million, but of course we know experts are estimating this to cost even $2 billion, and that could grow even further. But another thing that happened this week is, of course, the Canadian Taxpayers Federation offered free legal counsel to Cape Breton gun owners, citing police testimony about limited public safety benefits. And some other organizations have come out as well. I think the Canadian National Firearms Association, they said something along the same lines. So these firearms associations are trying to help the people proceed with this in any way they can. But to your question, Walid, beyond committee testimony, the program has been challenged by police union evidence on efficacy, the minister's own recorded doubts about enforcement resources, explicit non-participation by major police services and provinces altogether, and ongoing uncertainty on costs and timelines, which of course has all been repeatedly documented over the last few weeks. More Canadians are now on healthcare waitlists for surgeries, specialists, and diagnostics than there were at the end of the pandemic, according to government data acquired by the think tank Second Street. Data that they obtained through a Freedom of Information request and available government data shows that more than 3.7 million people are in limbo in the Canadian healthcare system on wait lists. The think tank Second Street estimates the number is closer to 5.8 million, as several provinces are missing data for specialists. Data from Yukon and Prince Edward Island are entirely missing, as they either do not know or don't collect data on patients waiting in the healthcare system. But the data does confirm that nearly 3.8 million people were on waitlists in Canada, which is a 26% increase from the 2.9 million confirmed cases in 2022 at the end of the COVID lockdowns. Second Street's communications director, Dom Lucic, said in a news release released on Wednesday from the think tank that Canada's healthcare system is, quote, broken and needs reform. Lucic said, quote, coming out of COVID, many were talking about the waiting list backlogs in healthcare. While the pandemic certainly didn't help, it's telling that even 3 years later, the number of patients on wait lists continues to grow throughout Canada. So, Walid, how does Canada fare against other universal healthcare systems in developed countries? Is the issue just a lack of funding?
First of all, we have to look at the public sentiment that we've observed in the country over the last couple of years. I mean, in 2020, across the board, and this was work done by Angus Reid Institute, the poll at about 49% of Canadians in 2020 said that they felt that the government was doing either a good or a very good job in handling healthcare. That number declined to 38% in 2021, 25% the following year, and in 2023, that number saw 24% across the provinces. So obviously, the public sentiment has been going in one direction, and that's downwards. So why is that decline so clear? Well, because Canadians are waiting too long for their services. About 46%, nearly half of Canadians surveyed, indicated they waited 2 months or more for a specialist appointment. That number declined to 15.1% in the Netherlands and 13.2% in Switzerland, two high-income OECD countries that do have universal healthcare systems provided for their citizens. And about 1 in 5, 19.9% of Canadians, reported waiting more than 1 year for non-emergency surgery. Just 0.5%, 0.6%, of Swiss respondents indicated a similar waiting time. And no one in the Netherlands has reported that survey that they waited as long as that. So comparing to those two countries, the Netherlands ranked higher than Canada, allows for private insurance firms to negotiate with healthcare providers on prices to provide more competitive pricing. And these insurance firms must also accept all applicants and charge their policyholders the same monthly fee for coverage. Pretty much, they can't discriminate based on pre-existing conditions. And Switzerland was ranked among the top three on critical healthcare measures. Patients must also purchase coverage in a regulated private insurance marketplace and share 10 to 20% of the cost of their care with an annual maximum protection for the most vulnerable. Now, that's exactly a critical point of mistrust in our system is the fact that our system in Canada is a very high cost system. Most Canadians don't actually know this, but in 2025, preliminary estimates suggested that the average payment for public healthcare insurance ranges for $5,000 to $19,000 for six common Canadian family types, depending on the type of family. Between 1997 and 2025, the cost of public healthcare insurance for the average Canadian family increased 2.2 times as fast as the cost of food, 1.6 times as fast as the average income, and 1.6 times as fast as the cost of shelter. It also increased much more rapidly than the average cost of clothing, which has actually fallen in recent years. The top 10% of Canadian families with the lowest incomes will pay an average of about $702 for public healthcare insurance this year. The top 10% of Canadian families earn an average income of $88,725 will pay an average of $8,292 for public health insurance, and the families among the top 10% of income earners will pay a whopping $58,853, and that's all through taxes. And this is, of course, according to the Fraser Institute's data. So high cost, competitively speaking, lower quality, and turnover time of service provided. And of course, the system is very clear to Canadians, hence why you see the decline sentiment of satisfaction. So a lot of things need to be done. And, for now, short answer to the question was we don't fare very well against similar countries in terms of wealth and countries that actually have that commitment. So we're pretty low among the, let's say, top 30 OECD high income countries that have the system in place that we want to achieve. We're pretty down near the bottom, but definitely high on spending. I believe we're top two in spending in that category, and second only to Switzerland as a ratio of our GDP.
That's it for today, folks. Thanks for tuning in. You can stay on top of new episodes every weekday by subscribing to the Daily Brief on iTunes and Spotify. Also, while you're at it, make sure to hit us with a 5-star rating and please leave a review.